Welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you will meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit www.rumcsi.org. According to the Centers for Disease Control and Prevention, about 36 million adults aged 65 and older will suffer a fall this year. More than 32,000 of these individuals will die because of injuries sustained from their fall. Another 3 million will require a visit to their local emergency department. Richmond University Medical Center's Trauma Department offers several programs to help reduce falls in older adults, thus preventing injuries, deaths, and trips to the emergency department. Here to tell us more about these evidence-based programs is Dave Briscoe, Trauma Injury Prevention Coordinator. Thanks for joining me, Dave.
Thanks for having me, Alex.
So I guess the best place to start is, what are some of the common reasons why people fall, aside from just tripping over something?
Well, Alex, besides slippery surfaces, tripping over items is one of the top reasons for older adult falls. Broken or uneven terrain, such as sidewalks and steps, poorly placed furniture, as well as scatter, rugs, clutter, sleeping pets even. You might step over your sleeping pet, startle them, and next thing you know, boom. Other times it's due to factors like poor lighting, inadequate footwear, whether they're too tight, too big, or just the wrong footwear for the occasion. Muscle weakness, balance issues, and sometimes underlying health conditions are major factors as well.
And that, I guess, includes also reactions to medications sometimes if somebody...
Oh yeah, definitely correct. Interactions with medications, adverse reactions as well.
And when we're talking about older adults, again, 65 and older, what are some of the more common injuries that they may sustain from a fall that maybe a younger person might not?
Well, injuries in older adult falls vary, but could range from something non-life-threatening like bruises or sprains to as serious as fractures and brain injuries. In fact, according to the CDC, more than 95% of hip fractures are caused by falls. These injuries can have serious consequences and may lead to a decline in overall health, mobility, independence, and even loss of life.
Wow. So before we actually talk about some of the programs that you provide to what are some tips that people can take to prevent falls in their home?
Well, first and foremost, keep your floors clear of clutter, regularly check and maintain the conditions of stair rails and walkways. Install handrails on staircases, both sides if possible. Install grab bars in your bathrooms, especially near the shower and toilet, and use non-slip mats. If you have loose rugs or carpets and can't replace them, you can use double-sided tape to secure them. Ensure good, adequate lighting, especially in hallways and stairwells. This can be as simple as adding night lights or changing your bulbs to a higher wattage, or even changing them out to LED lights. LED lights might be a bit more expensive than traditional bulbs, but they're brighter, last longer, and they're less costly overall in your electricity bill. Installing light switches at the top and bottom of your stairs as well. Wear appropriate non-slip footwear with good traction. You can add a pair that you wear just around your home. Reorganize items at reachable heights to avoid stretching and or using a ladder. Regularly get your vision and hearing checked is a big one. Exercise regularly to maintain strength and balance. And, keep a list of your medications, whether prescription or over the counter, and talk to your primary care physician about this list or your pharmacist for medication management. This can reduce interactions and side effects that may lead to falls.
So it sounds like there's a lot that people can do just to prevent falling.
There sure is.
So tell us now a little bit about the different programs that you offer to people to help them with their balance and prevent falls.
Sure. So we offer a program called Bingo Size, which is an evidence-based workshop combining bingo, exercise, falls prevention education, and exercise and nutrition education. We offer another program called Walk.
Well, how do you involve bingo in that?
So participants play the game of bingo.
Okay.
And in between the numbers being called, we have educational questions that we ask, and that they answer, and we have exercises as well.
What kind of exercises? Can you give us like a demonstration or something?
Sure. I definitely will. But there's seated exercises, there's standing exercises, but that's mainly to improve strength and muscle and coordination. We have another program called Walk with Ease, which is a multi-component program that also includes health education, stretching and strengthening exercises, and motivational strategies. There's another program called Tai Chi for arthritis and fall prevention, which is an enjoyable way of learning Tai Chi and practice at home. This program aims to enhance muscular strength, flexibility, balance, and stamina. We have another program called A Matter of Balance, which support older adults in overcoming the fear of falling by guiding them to see falls as controllable. A Matter of Balance helps to set activity goals, suggests small home adjustments to reduce fall risk, and offer exercise to enhance strength and balance.
So these four programs that you offer, is there one program that's geared towards one segment of the population, or do they have the choice, or do you make recommendations based on the group?
I mean, not really. I mean, if you have a fear of falling, then A Matter of Balance is pretty much the way to go.
Okay.
A Matter of Balance is pretty much the way to go.
Okay.
People with a fear of falling, people that fall before have developed sometimes a fear of falling, and that helps out. But all these programs are evidence-based, and depending on the program, it's 1 to 3 times a week for 8 to 16 weeks.
Okay. So could you give us some demonstrations of some of the exercises that you do with people, whether it's sitting down or?
Sure, definitely. Well, I'm going to show you a couple of sit-down exercises, and quite possibly a standing one.
So Dave, why don't you show us some of the techniques that you actually teach people in these classes?
Sure, I'm going to show you 3 simple exercises that can be done while you're at home watching TV or waiting for your toast.
Great.
All right. So this one is a standing exercise. This one is called heel raises, and you could just go up on the balls of your feet and raise your feet and come back down off your heels. And you're going to keep your head and neck straight and aligned, up and down. You could count down, you could do 30 of these, you could do 30 seconds worth of these, or even a minute. And you could do this in the kitchen while waiting for your toast or your kettle to boil.
And this is building leg muscle strength?
This is building leg muscle strength, yes.
Okay.
And the others that I'm going to show you are seated exercises.
Okay.
And the others I'm going to show you are seated exercises. This one is called side steps.
Okay.
What you want to do is that you want to make sure that your feet are about hip width apart. Your palms are going to be placed right on your thighs.
Okay.
And you're going to take one wide step out to the right or the left, whichever one you want to start with. So for this, I'm going to take one large step out to the right, up and over, and then bring it back. And then with the opposite leg, do the same. Up and over, and then bring it back. Now, obviously, this is a seated exercise. You can do this while watching TV or while your favorite show is on commercial.
I'm going to take a guess. Is this something to do with the hips?
This has something to do with your hips. This has something to do with your feet and sidestepping and coordination.
Oh, okay.
As well, imagine being in a movie theater and you're going down the aisle.
Okay.
Like you're passing people, you're stepping to the side.
Oh, I see. Okay.
Another one I'm going to show you is called chair stands.
Okay.
So what you're going to do is that you're going to start off in the same position. Your knees are going to be bent at a 90-degree angle.
Okay.
Your feet are going to be about hip width apart.
Okay.
You're going to take your hands, place it on the arms of your chair, and then you're going to slowly get up
Okay.
and then sit back down. Now, obviously, this exercise here helps improve your muscle strength. And imagine getting up and out of your couch or out of your chair.
Okay.
So this helps practice.
But you're not getting fully up.
You're not getting fully up.
I see.
This exercise is called chair stands.
Okay. And that's building, looks like arm strength and leg strength.
Leg strength, your glutes.
Wow. So those simple exercises can mean a big difference in someone that is prone to falls.
Huge difference.
And so these programs that you're offering, these are all free of charge, correct?
These are all free evidence-based programs that we provide at the hospital or at a center.
So if there's someone who's watching this episode and wants to have this program provided to their organization, how do they go about?
Okay, they can just reach out to me, give me a call, or shoot me an email, and we can get it started.
Great. And how often are you providing these classes around Staten Island?
Right now, I'm teaching 2 programs which is twice a week. So I'm going out to the community 4 times a week.
And how long are the classes?
About an hour and a half, depending on setup, but usually they range for about an hour.
And I'm sure you've had participants that come to you afterwards and be like, wow, it actually has made a difference?
They definitely love it. I have a center that I visit, and I've been revisiting because they love me there, and I've been there for about a year. So yeah.
Oh, that's fantastic. Well, thanks for showing us those brief demonstrations and helping us to prevent falls. As you heard Dave say, if you'd like to learn more about these programs, you can call Dave at 718-818-2901 and schedule a program. When we come back, Dave will share another injury prevention program available through RUMC called Stop the Bleed.
Hello everyone, my name is Maria Esposito and I'm board president here at Community Media of Staten Island. Are you looking for a platform to share your voice, creativity, and stories with the world? Look no further than Community Media of Staten Island. At Community Media, we provide you with the tools, the training, and support to produce your own TV shows, documentaries, talk shows, and much more. Tune into our channels or download our app to watch locally produced content that celebrates our community's diversity, talent, and spirit. Join us for studio tours, workshops, class trips, and more. Get involved, get creative, and get your message out there with the community television. Visit our studio and start sharing your story with the world.
We're back. Thanks for joining me on this episode of RUMC Vital Signs. Dave Briscoe, Trauma and Injury Prevention Coordinator, is still with us. And now we'll switch gears from how to prevent falls to how to help someone who has suffered a severe cut or puncture wound. The number one cause of preventable death after an injury is bleeding. Richmond University Medical Center offers a free course known as Stop the Bleed that trains people to recognize life-threatening bleeding and empowers them to take proven effective steps to stop severe bleeding. So Dave, tell us some of the background on the Stop the Bleed program.
The collaborative initiative behind the Stop the Bleed was spearheaded by the American College of Surgeons Committee on Trauma, aiming to disseminate bleeding control knowledge to the public in collaboration with the American College of Emergency Physicians, the National Association of Emergency Medical Technicians, and the Committee on Tactical Combat Casualty Care.
And what kind of bleeding are we talking about here?
A life-threatening bleed is a life-threatening bleed. A life-threatening bleed is large volume bleeding that is continuous, large volume pulsating, like a sprinkler, or is enough to pool in the clothing or on the ground.
So why don't you tell us a little bit about the ABCs of caring for someone who's suffered a severe bleed?
Sure. But before we get into the ABCs, first and foremost is your safety, which is paramount. If you can move the victim to a safe location, you should do so. If not, place yourself in a position to become just another potential victim. So A is for alert. The first thing you want to do is notify 911. You want help to arrive as soon as possible because ultimately someone with a life-threatening bleed needs surgical intervention. Sorry? You want to remain as calm as possible, know your location, when it happened, the number of victims and status of said victim, follow the instructions provided by your 911 operator. That's A. B is bleeding. You want to look for the source of the bleed. There could be multiple places that a person can be bleeding from, and clothing can hide it. So you might want to take off someone's shirt or pants. Modesty goes out the window when you're trying to save someone's life. C is the compressed pressure, whether it's direct pressure, wound packing, or tourniquet application, which depends on the location and severity of the wound.
So it sounds very similar to when they train someone to do CPR, that a very important component of the ABCs is that call to 911.
Correct. You want to get someone on that right away. If you are by yourself and you feel like you can't do so because you're already committed to direct compression or applying the tourniquet, you can ask your voice assistant to do so. If there's a crowd, you could delegate the responsibility to someone directly. You go, hey, you in the red shirt, please call 911. You want to make sure that someone's calling 911. Otherwise, everyone will be standing there and looking around thinking everybody else is calling 911.
Right, and it's so obvious a step, but when you're caught up in that moment, it's out of sight, out of mind.
Correct.
Do you treat a severe bleed for a child different from an adult?
Yeah, yes and no. The methods for managing bleeding in children closely resemble those used on adults. A tourniquet suitable for adult can be employed as long as it's applied effectively on a child. Okay. In cases where the child is too small for proper tourniquet application, applying direct pressure to the bleeding wound is generally effective. Wound packing techniques remain consistent for both adults and children.
Okay, so these are some of the tools that you use actually in the programs, the
Yes,
Stop the
they
Bleed
are.
program.
Yeah.
Okay, and these are meant to simulate any kind of a deep. Tell us what we're actually seeing here.
Oh, all right. So right now you are actually seeing two ham hocks that we use in our Stop the Bleed program. This is right here is a nice little gaping wound that we're going to pack.
Okay.
These wounds could be packed as well. This one could be direct compression, and you can also apply tourniquet to either of these.
So when you actually come across someone that suffered a wound, I mean, is part of the steps if there's to clean out the wound, if you see something in there, or is it stopping the bleed?
Never. It's actually stopped the bleed because someone could bleed out within 3 to 5 minutes. Hemorrhage is quite serious, and as mentioned earlier today, hemorrhage is the leading cause of death after trauma.
So if the patient is the person is conscious or unconscious, the main thing is focusing on the bleed, nothing else at that point.
Definitely. Even if you find cloth that's a little bit dirty, ultimately they're going to receive antibiotics at the hospital, and surgical intervention is what they need to stop their bleed.
And so what you're going to show us today in a couple of seconds with a demonstration, these are steps that someone can take if they come across someone who's bleeding. And these are steps that someone will take until medical professionals arrive?
Yeah, and actually these steps could be applied to yourself as well. So not only
Really?
to a bleeding victim, if you have a tourniquet and God forbid you're severely bleeding, you can apply a tourniquet on yourself.
Wow. All right. So we're going to do a demonstration now on a tourniquet as well as packing a wound. And I'd like to introduce Jennifer Sammartino, who is the Executive Director of Community Media of Staten Island, who will be our volunteer today. Hi, Jen. How are you?
Good.
Jen?
How are you?
Doing
Hi.
great. Dave showed Jen how to apply a tourniquet.
Great. All right, Jen. So imagine this leg being my leg. So
Okay.
I'm in this same position.
Okay.
This is my wound right here. First thing you want to do is open your tourniquet.
Okay.
And you're going to measure about 2 to 3 inches proximal
Okay.
from the wound. And you're going to place the tourniquet over there.
Okay.
So open that up. I'm
So
going to lift my
I'm
leg
gonna
up just a
lift you
little bit
up.
for you. And if you
Great.
can't remember 2 to 3 inches, then you want to apply high and tight. Okay?
High and tight. Okay. So
And-
2 to 3 inches about here.
2 to 3 inches is about right here. So you measure right from there. Bring that around and nice and tight.
So Dave, never on the wound itself.
Never on the wound itself. And if you're going high and tight, again, this is my leg, then you want to make sure that my pockets are empty while you're going around. So
okay.
you want true compression.
Okay.
All right, there. And then you're going to turn the cutlass one,
Okay.
either clockwise or counterclockwise.
Okay. Just making it nice and
Make it
tight.
nice and tight. Keep turning.
And I'm hurting you so badly.
Just a little bit. And once you turn it and it's nice and tight, you want to put it right there in the clip.
Tuck it in here.
Tuck it right there in the
Okay.
clip.
And
Good.
then-
You're going to bring that all the way around, the blue one, I'm sorry. And the white goes to secure it.
Okay.
And then you want to document the time.
Okay. That we did this.
Yes,
Okay.
because 2 hours after tourniquet is applied, cell death starts to happen.
Oh, wow.
And the tissues become necrotic. So
Okay.
cell death.
So maybe this is a stupid question, but obviously people are not walking around with this contraption in their pocket. So
Some
where do you?
are,
Oh,
actually.
really? Okay.
Some are. I mean, I carry in my trunk, but then this is what I teach, and I'm EMS.
Sure.
So there's a few that do.
So it's kind of like a mouth guard for CPR. You want to have it on you in the hopes that you never have to use it.
Correct.
So when someone takes the Stop the Bleed program, does everyone get one of these?
No, actually, they could reach out to stopthebleed.org and they could place an order for one. Or I'm sure you can find it on Amazon as well.
Do you know how much one of these costs? I do not. You don't? Okay, no problem. All right. So that's how you do a tourniquet. So in this case, Jen has helped to save your leg.
Yes.
And you said 2 hours is when cell death starts to occur if this
Correct.
tourniquet stays on.
Correct.
And you should never loosen this, even if the person is screaming.
You never loosen it. The tourniquet is married to them until they go into surgery and surgical intervention begins. If that person is still bleeding and you have another tourniquet, you could place that one proximal to this one, but you never loosen or You should never loosen the tourniquet.
Okay. So, and I guess then, given everything you've just said about the importance of the tourniquet, that when medical professionals arrive, it's important to let them know that you have applied a tourniquet in case it's not visible.
Correct. And obviously, if you don't have a marker or a pen to document the time, you could just take a quick estimate, look at your phone.
Right, sure.
Okay. All right. So now that we've applied a tournament, Jen, we're going to have
Okay.
you pack a wound.
Okay.
With
All right,
this
let me-
ham piece here.
Oh, that was much neater. This is really gross. Can everyone see this? This is
Okay.
really
So
gross.
this is what kind of wound is this simulating, Dave?
So that's stimulating a puncture, a deep puncture wound.
Okay.
So that could be from anything.
that there. Okay.
Yeah.
Okay.
So we're going to pack this wound.
We're
right?
going to pack this wound and then apply direct compression to the wound.
Okay.
Okay.
All right.
So this is your gauze. What comes in the Stop the Bleed kit is a hemostatic dressing. What you're going to do is that you're going to open this up.
Okay. Unravel it.
Yep, unravel it some.
Now, assuming somebody doesn't have gauze in their pocket, you can use any kind of a cloth.
Yeah, that's fine. You can use any type of cloth.
Okay.
Like I said, once they get to the hospital, they will provide antibiotics, so they're fine.
Gotcha.
Okay.
And the main thing you want to focus on is absolutely saving someone's life, so stopping the bleed.
Right.
All right, so now what you're going to do, sounds a little gross, is that you're going to take your finger and then you're going to push some of the cloth in. I know.
Like that.
Yep, just like
And I'm just
that.
going to stick my finger
You're gonna stick
in
your
this
finger
person.
in this
All right.
person's wound.
Got it.
Good. And then you're going to
Oh,
gather
Dave,
up
come
more.
on.
and stuff. You kind of want to fill that
Okay.
void. Imagine stuffing cloth or some type of rag into your pocket, right? So you're filling this void here, and then you want to just, and then you're going to take, and also be mindful of any broken bones, anything sharp in there, because
Right.
you don't want to cut yourself.
Sure.
Right?
Okay.
All right, and now you're going to take the rest of the cloth,
Okay.
not all of it, just
Okay.
enough
Just
to
a lot of
cover
it. Okay.
Just enough to cover it. Good.
Okay.
Let's do a little bit more.
Okay.
Good. And then you're going to put hand over hand as
Okay.
if you're doing a CPR compression. You're going to lock your elbows.
Okay.
And then you're going to bear your weight down on it. And you're going to stay like that until help arrive. You're not going to pull up to take a look to see if they stopped
Okay.
bleeding. This
Okay.
is just here until
I'm
help
stuck here
arrives.
until the ambulance comes.
Exactly.
Got it. Okay.
And then obviously the ambulance come and you probably have blood all over you because
Right.
you don't have gloves. You let them know that you have this person's blood on you.
Right.
And then they will just keep you involved and tell you what to do. And
Okay.
you're going to wash with soap and water.
Okay.
Great.
Great. Easy enough.
You saved 2 lives today, Jen.
All right. I can go home
Yay.
now, right?
Yes.
All right.
Well, thanks for coming on and being a volunteer.
My pleasure.
And let me take this opportunity to thank you and your entire staff here for hosting Vital Signs and
It's our
having us
pleasure.
here.
Thank you.
Thank you so much.
All right. Nice to
Thanks,
meet you.
John. Nice to meet you.
Dave,
Yeah.
thanks for coming on the show
Thanks
and
for
for
having me.
showing us how to do Stop the Bleed and prevent falls. I want to thank again Dave for coming onto the show and taking the time to show us just a quick few ways to prevent falls and stop severe bleeding. Again, both programs we discussed in this episode are provided at no cost by Richmond University Medical Center. If you'd like to learn more or schedule one or both of these programs at your place of work, your organization, or business, you can contact Dave at 718-818-2901. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for nearly 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click the donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
Are you prepared to save a life? Opioid overdose is the leading cause of accidental death in the United States. Due to their effect on the respiratory system, opioids may cause breathing to stop. When this happens, brain damage can occur after 4 minutes. and death can occur 4 to 6 minutes later. It takes an average of about 10 minutes for emergency medical services to arrive, which can be the same amount of time as a potential overdose death. So it is crucial that treatment be administered as quickly as possible. Having Narcan nasal spray on hand allows you to respond first and help save a life. Naloxone, the active ingredient in Narcan nasal spray, is the standard of care for treatment of opioid overdose. But only about 1 in 5 opioid overdose victims receive naloxone prior to EMS arrival. Now, everyone has access to the same treatment used by emergency responders. If you suspect an opioid overdose, check to see if the person will not wake up, is very sleepy, or is not breathing well. Do not test the nasal spray device before use. Narcan nasal spray is for use in the nose only and is safe to use even if opioids are not present. Hold the nasal spray device with your thumb on the bottom of the plunger. Insert the nozzle into either nostril and press the plunger firmly to give the dose. One nasal spray device contains 1 dose of medicine. Call 911 immediately after giving Narcan nasal spray. If the person does not wake up, continue to give doses every 2 to 3 minutes until the person wakes up. It is safe to keep giving doses. Stay until an ambulance arrives, even if the person wakes up. You have the power to save a life. For more information, visit Narcan.com. An opioid is a type of drug used to reduce pain. An opioid emergency happens when too much of the drug overwhelms the brain and interrupts the body's natural drive to breathe. Opioid emergencies are a fast-moving epidemic affecting people nationwide, regardless of age, gender, or location. However, negative attitudes driven by stigma may hinder one from being prepared to help save a life. People may think, it could never happen to me, or I don't know anyone who could overdose. But chances are, they do. And even if they don't, they can still be ready to make a difference. An opioid emergency can happen to anyone. A child, a parent, a friend. It's time to change the way we think and talk about opioid emergencies. And it starts with a simple message. You have the power to save a life.
Hi, I'm Jennifer Sammartino, Executive Director of Community Media of Staten Island. Community media is so important in today's world. We offer the opportunity to storytell, share opinions, create unique content, educate, and much more. We consistently work with local nonprofits to help them in getting the word out about their mission and activities, and have an internship program for students to work in the field, as well as a robust school program where we welcome children into the studio regularly. But the reality is that across the state, our local centers are in trouble. Historically, our revenue comes from cable franchise fees, and as more and more people opt for streaming alone, we lose out. That puts us in danger of having to downsize, and some centers may close altogether. Your support of the Community Media Reinvestment Act is crucial to the survival of centers like ours. So how do you help? It's easy. Visit our website at communitymediasi.org and click on the Continue tab on the homepage where it talks about the Community Media Reinvestment Act. That link will allow you to send a letter directly to elected officials and share your support. That's it. That's all we need from you. So please visit our website at communitymediasi.org and share your support with our elected leaders at the state level. Thank you and have a great day.